The American Cancer Society is the community-based, nationwide voluntary health organization dedicated to eliminating cancer as a major public health problem by preventing it, by saving lives from it, by reducing suffering through research, education, advocacy, and service. I share that with you quickly, and sometimes we have fun, say how fast can we say it and get it right. The point is, it is a comprehensive mission. The point is that it is the only cancer-fighting organization in the world, Father, that is in every community in America. And if you say, I have a problem with cancer, we never say, I'm sorry, there's nothing we can do for you, because we don't deal with that. We don't deal with cancer service. We don't deal with palliative care. We don't deal with research. We don't deal with advocacy. We deal with all types of cancer. We actually publish cancer facts and figures every year, which is the official publication for the entire nation on the number of new cancer cases, number of cancer deaths by site and by state, as just an example of some of the things we do. My point here is simply to say we are, and there are like 800, there's been a doubling, roughly doubling of the number of not-for-profits in America in the last 20 years. So now 1.5 million not-for-profits. About 880 of them say they're here to do something about the cancer problem. Some are extraordinarily wonderful organizations that we partner with and work with, like Livestrong. Others are fraudulent. 275,000 in a month, will not of cancer, but of not-for-profits will disappear because they haven't even filed the papers that they're obligated to file with the government. But there are 880 that say they're here to do something about the cancer problem. Only one of those 880, your American Cancer Society, is in every state, in all 435 congressional districts, and for all intents and purposes, in every community wherever the American flag flies. An opportunity. We are the largest voluntary health organization of any kind, not just cancer, in terms of revenues and number of volunteers. So we have 6,000 staff. We think of it as lean and mean. We used to have more, but we still have 3 million volunteers that help us. You heard yesterday about just some of our research programs. We're the only organization of our kind that conduct our own intramural research, where we're able to follow 1.2 million Americans through their whole life and until they die, which gives us an idea about causes of cancer in a population that might never otherwise be discovered, and thus have led to publications about the relationship of diet and exercise and so forth to cancer. Advocacy. We created a decade ago a sister organization called the American Cancer Society Cancer Action Network. We discovered when we set our 2015 goals that we were making progress on them. We're saving, as Pat mentioned earlier, 350 more lives per day, but we weren't going to make those goals, and so my board said, John, come back and tell us what we got to do to make them. Instead of changing the goal, what do we got to do? And we discovered what those things were, and we found out, interestingly, that we needed to redouble research, we needed to promote prevention into public policy everywhere, and we needed to provide access to quality health care to everyone who needed it, when they needed it, where they needed it. Undergirding all three of those was advocacy.